Hello everyone and welcome to today's lecture on Lyme disease. This is an increasingly important topic in public health, and understanding its intricacies is crucial for both individuals and healthcare professionals. Today we will break down what Lyme disease is, how it spreads, its various stages and symptoms, current treatment options, and effective prevention strategies. And I will be using this content to illustrate key concepts and information. So let's dive right in. So, what exactly is Lyme disease? At its core, it's a bacterial infection caused by a type of bacteria called spirochete. The primary culprit in North America is Borrelia burgdorferi. These bacteria have a distinctive spiral shape which you can visualize as a teeny corkscrews, and they are highly motile, meaning they can move around using structures called flagella. It's important to note that in other parts of the world, particularly Europe and Asia, other closely related Borrelia species such as Borrelia garinii and Borrelia avgelii can also cause Lyme-like illness. These bacteria also have a unique cell membrane composition that contributes to their ability to evade the host's immune system. Lyme disease is classified as a vector-borne disease. This means it's transmitted to humans through the bite of an infected vector. In this case, certain species of Ixodes ticks. Because the bacteria can spread throughout the body, and Lyme disease is considered as systematic illness, meaning it can potentially affect various organ systems, leading to a wide range of symptoms if not detected and treated early. Let's take a look at the recent epidemiological data on Lyme disease. We are observing an increasing incidence of Lyme disease and a globally expanding range. Several factors contribute to this rise, including climate change, which is altering tick habitats and activity patterns, deforestations, which brings humans and ticks into closer contact, and suburban sprawl, which encroaches on tick inhabited areas. Within the US, the highest prevalence is concentrated in the Northeast, the Upper Midwest, and the Mid Atlantic states. Similarly, Central, Eastern, and Northern Europe, as well as parts of Russia, China, and Japan in Asia, also report significant numbers of cases. It's crucial to understand the scale of the problem. The Centers for Disease Control and Prevention in the US estimates that there are approximately 476,000 new cases of Lyme disease each year. This figure is our best estimate and attempts to account for significant underreporting. Underreporting is a significant issue due to several factors. Lyme disease symptoms can be highly variable, making diagnosis challenging. Also, some patients may have what's called seronegative Lyme disease, meanings they do not produce the typical antibodies that diagnostic tests look for, leading to false negative results. Certain factors increases the risk of contracting Lyme disease. These include engaging in outdoor activities such as hiking, camping, and gardening, which bring people into contact with the tick habitats. Certain occupations, such as landscaping and forestry, also carry a higher risk. Lyme disease exhibits a distinct seasonality and peak incidence occurring in the late spring and summer. This coincides with the peak activity of neem stage tick, and which as well as discuss are particularly important in transmission. So we also see a bimodal age distribution in Lyme disease cases with peaks in children, particularly those aged 5 to 14, likely due to their outdoor play, and in adults, often those aged 45 to 64, due to occupational or recreational exposure to tick habitats. So how does the bacteria makes its way from the ticks to humans? The primary mode of transmission is vector transmission. specifically through the bite of infected Ixodes ticks. In the eastern United States, the main culprit is Ixodes scapularis, commonly known as black-legged tick. In the western US, it's Ixodes specificus, or a western black-legged tick. Other Ixodes species are responsible in Europe and Asia. To understand transmission, it's helpful to know the tick life cycle, which consists of four stages: egg, larva, nymph, and adult. Nymph stage ticks pose the greatest risk of transmitting Lyme disease. They are very small, about the size of poppy seed, making them difficult to detect. And they are most active during the summer months when people spend more time outdoors. Adult ticks can also transmit the bacteria, but they are larger and more easily noticeable and removed. A crucial point to emphasize is that the infected tick generally needs to be attached for more than 24 to 48 hours to transmit the Borrelia bacteria. Note it. This highlights the importance of prompt tick removal. The longer a tick is attached, the greater the risk of transmission. It's also important to clarify that Lyme disease is not directly transmissible. There is no evidence of person to person transmission. You cannot get it through the air, food, water, or casual contact with someone who has the disease. Several cofactors can increase a person's risk. These include living in or visiting areas with a high density of infected ticks, proximity to tick habitat, and engaging in behaviors that increase exposure to ticks, such as hiking off trail and not using insect repellent. Lyme disease can progress through three stages if left untreated. Okay, and it's important to recognize that not every patient will experience all of these stages. The first stage is known as early localized Lyme disease, occurring from days to weeks after the tick bite. A hallmark of this stage is the erythema migrans, or EM rash. This rash often has a characteristic bull's eye appearance. You can see in the picture. Through this, it spreads all over the body, and it's important to note that this classic presentation occurs in only about 70 to 80% cases. The rash is typically expanding, circular or oval shaped, and may be warm to the touch, but it's usually not painful. In addition to rash, patients may experience flu-like symptoms such as fever, fatigue, headache, muscle aches, known as myalgia, joint pain, or arthralgia, and swollen lymph nodes, or lymphadenopathy. If the infection is not treated during the early localized stage, it can progress to early disseminated Lyme disease, which can occur weeks to months after the initiation of the infection. In this stage, the bacteria begin to spread throughout the body. Patients may develop multiple EM rashes, indicating that the bacteria have spread through the bloodstream. Neurological manifestations occur in about 15% of untreated cases and can include cranial nerve palsies, most notably Bell's palsy, which causes facial drooping, as well as meningitis and radiculopathy, which causes nerve root pain. Cardiac involvement, known as Lyme carditis, occurs in about 1% of cases and can lead to atrioventricular block, or AV block, also palpitations and chest pain. Ocular manifestations such as conjunctivitis, uveitis can also occur. Musculoskeletal symptoms may include migratory joint pain, where the pain moves from one joint to the another, and muscle pain. The final stage is late disseminated Lyme disease, which can occur months to years after the initial infection. The most common manifestations of this stage is Lyme arthritis, which occurs in about 60% of untreated cases. This typically presents as monoarticular or oligoarticular arthritis affecting one or a few large joints, with the knee being the most commonly infected. So, patients may also develop chronic neurological complications such as peripheral neuropathy or encephalopathy, which can lead to subtle the cognitive deficits affecting memory and concentration. In Europe, a skin condition called acrodermatitis chronica atropicans or ACA, characterized by skin discoloration and thinning, is sometimes seen in late stage Lyme disease. Let's consolidate the symptoms we have discussed into early and late manifestations. Early symptoms, which typically appears within days to weeks after a tick bite, often include the characteristic erythema migrans or EM rash. However, as we mentioned, the rash is not always present, occurring in about 70 to 80% of cases. Other early symptoms can be non-specific and flu-like, such as fatigue, fever, headache, muscle aches, or myalgia, joint pain, arthralgia, and swollen lymph nodes or lymphadenopathy. If left untreated or if the diagnosis is delayed, Lyme disease can progress to late stage symptoms. This can include more persistent and severe joint pain and swelling, often manifesting as arthritis, particularly in knees. Neurological problems can also arise, such as peripheral neuropathy, nerve damage causing numbness and weakness. Encephalopathy means brain dysfunction, and cognitive deficits affecting memory and concentration. Patients may also experience gait abnormalities, and although it can occur in early disease, Bell's palsy can persist and develop in the later stage. Cardiac complications, including carditis, arrhythmias, can also occur. In Europe, a skin condition called acrodermatitis chronica atropicans is a notable late stage manifestations. The primary treatment for Lyme disease is antibiotic therapy. Prompt treatment, especially in the early stages, is crucial for preventing the later complications. For early localized Lyme disease, oral antibiotics are typically prescribed. These include doxycycline, amoxicillin, or cefuroxime acetyl. The usual duration of treatment is 10 to 21 days. The choice of antibiotics depends on the factors such as patient's age, medical history, and any allergies. Doxycycline is often favored for its effectiveness against other tick-borne infections that may be present. For patients with early disseminated or late stage Lyme disease or those with neurological or cardiac involvement, intravenous antibiotics are generally recommended. These include ceftriaxone, cefotaxime, and penicillin G. The duration of IV therapy is typically 2 to 4 weeks, but it may be longer in some cases, depending on the severity and the specific manifestations of the disease. In addition to antibiotics, symptomatic treatment can help manage the symptoms of Lyme disease. Non-steroidal anti-inflammatory drugs, NSAIDs, are commonly used to reduce the pain and inflammation, particularly in the cases of Lyme arthritis. It's important to address a challenging aspect of Lyme disease treatment, post-treatment Lyme disease syndrome or PTLS. Some patients continue to experience persistent symptoms such as fatigue, pain, and cognitive difficulties even after completing a standard course of antibiotic treatment. The pathophysiology of PTLDS is not fully understood, and it's an area of ongoing research. Importantly, prolonged antibiotic treatment has not been shown to prove a consistent benefit for PTLDS and carries its own risk. The current focus is on managing the patient's symptoms through a multidisciplinary approach. This may include pain management strategies, physical therapy, and cognitive rehabilitation, and to help the improve patient's quality of life. Regarding vaccines for Lyme disease, it's important to note the history. A Lyme disease vaccine called Lymerix, Lyme Erix, which was a recombinant OSPA vaccine, was previously available and FDA approved. However, it was withdrawn from the market in 2002 due to a combination of low public demand and concerns about potential side effects. Although the evidence for this kind of side effects was not definitive. Currently, there is no widely available human vaccine for Lyme disease in use. However, there is ongoing and promising research in this area. Several new vaccine candidates are in various stages of clinical trials. These new vaccines are exploring different approaches, such as again targeting OSPA and other Borrelia antigens, or even proteins found in the tick itself to prevent the transmission of the bacteria to humans. One promising vaccine candidate is VLA15, developed by Valneva and Pfizer. This vaccine is currently in phase 3 clinical trials and also targets OSPA. The vaccine is designed to be administered in a series of doses before the start of the tick season to provide the protection during the peak exposure period. While these new vaccine candidates hold promise, it's important to understand that they are still under development and we don't have a widely accessible human vaccine at this time. This is an area of active research and hopefully an effective vaccine will become available in the future. So prevention is key when it comes to Lyme disease, and a multi-pronged approach is most effective. There are several personal measures are available and environmental strategies also available that individuals and communities can employ to reduce the risk of tick bites. Let's start with personal protection measurements. The first step is to avoid tick habitats whenever possible. This includes wooded areas, tall grass, leaf litters, which are common habitats for ticks. When you are in these areas, use insect repellents, deed-based repellents with a concentration of 20 to 30% are effective and can be applied to both skin and clothing. Picaridin is another safe and effective repellent that can be used on the skin and clothing. Permethrin is a particularly effective insecticide that kills ticks on the contact. However, it should only be applied to clothing and gear and even never directly on the skin. Oil of lemon eucalyptus or OLE is a plant-based repellent that can also provide protection. Wearing protective clothing can also significantly reduce your risk. Opt for long sleeves, long pants, and tuck your pants into your socks to create a barrier. Light colored clothing can make it easier to spot ticks that may have attached to you. Regular and thorough tick checks are crucial, especially after spending time outdoors. Check your body daily, paying close attention to areas where ticks tend to attach, such as warm and moist areas like the groin, armpits, and behind the knees, as well as the hairline, scalps, ears, etc. Showering soon after being outdoor, ideally within 2 hours, may help wash off any unattached ticks and potentially reduce the risk of Lyme disease transmission. In addition to personal measures, there are also environmental and residential measures that can help control tick population. Landscape management play a crucial role. This includes clearing brush and leaf litters, mowing the lawn frequently, and creating a tick-free zone around your property by using a barrier of gravel or wood chips to separate your lawn from wooded areas. Tick control products such as acaricides acaricides and can be applied to the professionals to reduce tick population in heavily infested area. Targeted treatments such as tick tubes, which distribute tick killing chemicals to rodents that serve as hosts for young ticks, can also be effective. Finally, public awareness and education are essential components of Lyme disease prevention. It's crucial to educate the community about the risk of Lyme disease, how to prevent tick bites, and importance of early diagnosis and treatment. Educational efforts should be important and should be targeted towards the high risk groups such as outdoor workers, hikers, and residents of endemic areas. So let's address some frequently asked questions about Lyme disease. A common question is, how long does a tick have to be at us to transmit the Lyme disease? So answer is, generally the risk of transmission is low if a tick is removed within the first 24 to 48 hours. However, the risk increases significantly with longer attachment time. So prompt tick removal is crucial. Many pet owners ask, is Lyme disease curable in dogs? The answer is yes. Lyme disease in dogs is treatable with antibiotics and most dogs recover well. However, it's essential to seek veterinary care if you suspect your dog may have Lyme disease. Another frequent question is, how long does Lyme disease test take? So typically, blood test results take a few days to week to come back. It's important to understand that Lyme disease testing usually involves a two-step process. The first step is screening test, such as an EIA or IFA. If that test is positive or indeterminate, or a second more specific test called a Western blot is performed to confirm the diagnosis. A more complex question is Lyme disease an autoimmune disease? Lyme disease itself is not primarily classified as an autoimmune disease, which is when your immune system attacks your own body's tissues. However, in some cases, Lyme disease can trigger autoimmune responses, which may patient can experience, and the symptoms persistent in longer period of time. Many people wonder that are there natural remedies for Lyme disease? It's important to emphasize that there are no proven natural remedies that can cure Lyme disease. Antibiotics are the standard of care and the most effective way to eradicate the infection. While some natural remedies may help with certain symptoms, they should only be used under the guidance of healthcare professionals and should not play conventional antibiotic therapy. Another important question is, can you get Lyme disease more than once? Unfortunately, yes, you can get reinfected with Lyme disease. Immunity following a Lyme disease infection is not always lifelong or complete. So it's possible to contract the disease again if you are bitten by another infected tick. The question of how to promptly remove a tick is also very common. The best way to remove a tick is to use fine tipped tweezers. Grasp the tick as close to the skin's surface as possible and pull straight out with a steady motion, avoiding any twisting or jerking. After removing the tick, it's important to cleanse the area thoroughly with soap and water. Finally, it's important to clarify, does every tick bite cause Lyme disease? The answer is no. Only infected Ixodes tick can transmit the Lyme disease bacteria. The risk of getting Lyme disease from a tick bite is relatively low if the tick is removed promptly within the 24 hours. That brings us to the end of our lecture on Lyme disease. I hope this overview has provided you a complete, comprehensive understanding of this important topic. Remember, awareness, early detection, and prompt treatment are crucial for managing Lyme disease effectively. If you have any concerns about Lyme disease, please consult with a healthcare professional. Thank you for watching. If you found this information helpful, please like this video and share it with others who may be benefited with this. And don't forget to subscribe to my channel for more educational content on important health topics. Your support helps me to create more videos like this one. Stay informed, stay safe, and I will see you in the next video.